Good afternoon, everyone, and welcome to the next installation of MCEDA's ongoing webinar series. My name is Judy Varela. I am the Medicaid Services Program Manager for MCEDA, and I will serve as the moderator for today's webinar. For those of you who are not familiar with MCEDA, I'd like to take a moment and provide you with an overview. The Michigan Center for Effective IT Adoption, or MCEDA, was created in 2010 with federal funding from the Office of the National Coordinator for Health IT, or the ONC. Led by Altarim Institute, MCEDA's mission is to accelerate the adoption and meaningful use of health IT for the purpose of improving quality and efficiency of care delivered in our state. Recently, MCEDA has received additional funding from the Michigan Department of Community Health to further support these efforts. To date, MCEDA has helped more than 5,000 Michigan providers with their EHR adoption, and 2/3 of those providers have achieved stage 1 of meaningful use, earning a combined total of more than $50 million in CMS incentives. In fact, 1 out of 3 Michigan providers that has earned an EHR incentive has been an MCEDA client. So I'd like to review briefly just a description of our services. We'll take a look at our 3 service tracks. The first service track that really launched our program was directed at primary care, and that was a result or possible through the funding provided from the ONC. Last summer, we launched our Medicaid program, initially beginning with Medicaid specialists. However, we are now able to provide services to any Medicaid provider in any stage of meaningful use, and those are subsidized services. And our third track is what we refer to as our commercial services, which is really where any customized needs would fall, or any services directed at providers that do not fit into one of our subsidized buckets. Today's presentation will take a look at the meaningful use requirements for patient portals. We'll link that information to practice transformation. We will provide a review of the benefits of a portal and share information about some myths that are out there, the misconceptions, best practice information, and then a description of how MCEDA supports portal implementation. And with that, I will turn it over to our first presenter, Dan Belknap, one of our client service managers.
Thanks, Judy. This first slide shows some of the shifts in healthcare, and I'm sure most of us have experienced some of these directly. What I want to call your attention to is the one in the middle. These are the patients that we are trying to push from becoming passive recipients to actually being active and self-managing their own care. Some of the headlines show patient engagement, and also a quote down here: patients are actually the blockbuster drug of the century. I think if every provider across the country was a meaningful user, just as an example, and we didn't have patients engaged in their own managing their own care, that is, following some of the protocols that they're given by the provider, taking their medications as they should, we'd still see people using the emergency room for primary care, and we'd also see BMIs climbing through the roof as they're doing today. In 2010, there was a survey by Markle that looked at both from public and physicians in regard to the stimulus, the incentive plan. One of the key findings is good for us. 2 out of 3 members of the public and doctors, they're both in agreement that patients need to be able to download their health information. The gap comes in when you look at a second finding that says 93% of both of the public rarely or never even asks for a copy of their personal health information. So how are we going to begin to fill that gap? Other research findings show that patients forget almost at least half of medical information provided by the doctor as they're walking out of the clinic. Other information shows that providers and patients overestimate the patient understanding the medical information. But we're starting to learn from some of this that combining oral and written information is better than only oral and only written information. So when it comes to patient portals, this is just another way that we can continue to improve how we engage with patients. From a meaningful use standpoint, they're also one of the biggest drivers, actually, in pushing patients toward engagement. You can see by the stage 1, that's really involved in setting up systems for recording and communicating information to the care coordination team. But by stage 3, which is not even out yet, we need to have patients accessing self-management tools. So again, we see kind of a gap. And the portal, as we'll find out a little bit later today, begins to bridge that gap. So as we look back at the actual meaningful use measures, last year in 2013, stage 1 had 2 different measures. One, Core 12, an electronic copy of the patient health information needed to be provided within 4 days upon a request from a patient. So there was a 50% performance measure there. And there was also a menu item that described patient electronic access, which could be a patient portal. Both of those have been subsumed in 2014 into a single core measure. So this is a requirement for everyone in stage 1 to provide patients with the ability to view online, download or transmit, DDT, their health information. Again, that's been within 4 business days of being available in electronic form. For stage 2 in 2014, the measure from stage 1 has been added just a little bit, that patients actually have to take an active role in the viewing, download, and transmitting of their health information, and that's a low threshold of only 5%. So what does this mean to you? If you look at the box in the middle, you must provide patients with the ability to view their health information online, as in through a patient portal. And the exclusion that is also mentioned here in that last box is kind of hard to imagine a provider that would not order or create any of the required information. But I know this is a concern for a lot of people listening in today, and certainly many of the clients that we've been working with so far this year. So a question was posed to CMS, which provided guidance. And this question, if a patient has been given the option of accessing a portal and has been given information about how to set up a portal but chooses not to set up a portal, that is, they don't provide an email address, does not complete any validation steps, and does not provide online permissions, for instance, can this patient be included in the numerator? And fortunately, the answer is yes. So provided all required health information is loaded within the 4 business days that we saw in the meaningful use measure. The one recommendation that we make is to ask your EHR vendor how the software that you're using currently tracks the numerator for this measure, because different software systems might track it differently or trigger differently. So as we look at the meaningful use requirements, we just learned that you need to provide patients with the instructions that are necessary to actually create a site on the portal so that they can view, download, and transmit. But let's look at the specific data requirements. This is the information that once a patient goes into the portal, they need to be able to see this kind of information, or this specific information, not just their own name and provider name, but these other data points you see here, procedures, lab results, and so on. Any exceptions to this data are basically these 3, that if the data is not, if your certified system does not have the functionality to provide and load this information into the patient portal, or if there's a law restricting the information regarding privacy, or if the provider feels that there may be substantial harm from this information. For instance, negative lab results may pull that before having a discussion with the patient directly about that. So let's put some of the pieces together. You see on the left-hand column there a number of different meaningful use measures. The top ones here are from stage 1. These next 2 are from stage 2. And the security risk analysis is really for all stages. You need a security risk analysis for that first incentive that you attested for, and then at least a review of those security measures throughout the remaining incentive years that you attest to. So if we were to look at patient and family engagement, clinical summaries has been a core meaningful use measure that you needed right beginning in 2011. Now, starting this year, you can load those clinical summaries into a patient portal, which then, if you get your patient to enroll in that portal, gives you the option to load your educational resources, as well as any kind of reminders can be sent through the portal. Summary of care, if you're transferring or referring your patient. Lab results can be loaded, and from stage 2, both family history and secure messaging. Now, in order to get your patient enrolled in the patient portal, you need to also give them that secure feeling that their personal information is being protected. And that's why, surrounding all of this, we have the security risk analysis as part of the meaningful use measures. Now, just in the past couple of weeks or so, CMS thought everyone was having a little bit too much fun, so they added a level of complexity called the NPRM here. And that is pretty much to provide a little bit of flexibility and actually rolling back the clocks to 2013 for the meaningful use requirements for certain categories of practices that are having issues with their software. Right now we're in the 60-day comment period that ends in just about a month from today. And that's comments from anyone across the country who wants to offer some thoughts about risks to delaying this meaningful use or rolling back the clock, if you will. So what that means is that CMS needs to respond to each one of those comments, and it is too difficult to say at this point in time anyway when that final rule will actually come out. The one thing we do know is that the first year of Medicaid meaningful use, sometimes referred to as AIU, is still going to require 2014 certified software. Our recommendation, that you don't change any of your plans for 2014. So you'll want to complete a hardship application, which is due in less than 2 weeks now, if that's appropriate for you. You also want to continue any of the 2014 measures according to the current rules. And we just want to remind everyone that in 2015, everyone is required to start using the 2014 edition of their software. And this also means that if you are in your 365-day reporting period for 2015, that's going to get going right January 1st. And last but certainly not least, is the ICD-10 is still expected to go live October 1st of 2015. Now I'd like to turn it over to Chris Alger.
Thank you, Dan. And so I'm going to kind of change course here a little bit and talk about patient portals from the perspective of improving your operations, getting more productive, and getting more efficient. So I'm going to begin by talking about some of the benefits of patient portals in terms of patient or consumer satisfaction, improved communications, and reduced cycle time, which of course is how patients enter, move through, and exit your practice. I'm also going to touch upon some of the top myths and misconceptions that we see out there, or what I like to call sort of half-truths. I'm going to share some best practices, and I'm going to try to make the connection to practice transformation, which is somewhat of a buzz term or a buzz phrase that we're using more and more. So this is kind of my visual around what practice transformation looks like. So at the top there, at the core is clinical, is quality, it's effectiveness, is how we deliver our care and the outcomes that we get. And then there's also the efficiency piece, and that's how we go through our daily work, how we use our workflow and our processes. Then, of course, a big part of this is health IT, which is especially important when we consider the electronic health record. So we've got that smart use of technology piece. And when you think about a patient portal, it's really technology, but it's also very much a function of processes around that technology and people who work within those processes. So this is kind of my mental framework on how to think about practice transformation. So a little context here. When we think about patient portals and whether or not consumers or patients are going to use patient portals, just consider for a moment the number of transactions that people engage in every day on the internet, whether it's banking, travel, or shopping, or just using Google. And the research is quite clear. Patients want direct access to their records, and they also want access to their providers. In fact, in a Wall Street Journal in Harris Interactive poll, they found that 73% of the patients polled wanted to be able to communicate with their providers directly, and less than 9% report having the ability to do so. So access problems obviously do kind of heighten and promote patient dissatisfaction. Some other benefits to consider around patient portals. So really, patient portals is a way to drive patient engagement, right? Create more activated patients. So that's a given. But I want to focus on the productivity and efficiency part. So one, of course, that we know that patient portals can really improve practice and patient communication. We know that portals can drive efficiency. It can reduce the time that you spent on non-productive tasks, or as we like to say in the lean world, waste, which is also referred to, believe it or not, as stupid nothing. So two or three is really important here. Patient portals can really drive physician productivity. And so if you think about this, and we covered this in our lean webinar a couple of months ago, so the research is very clear in that providers, or physicians rather, are about 70% as productive as they could be. Through no fault of their own, we find that they're doing some work, approximately 10% of that work is wasted stuff they shouldn't be doing, and then another 20% is stuff that they could delegate to others. And that's really important when we think about physician and patient communication from a patient portal perspective. And what I think about patient communication, and as you think about how you interact with patients in your practice, I think that communication with the patient can be one of the most challenging parts of running a medical practice. Certainly it's one of the most challenging parts of that patient-provider or practice interaction. And as you think about patient communication and all the problems that it can pose from a productivity standpoint, having prepared patients, having satisfied patients, having the right information at the right time, all these things can impact revenue. So how do we go about improving communication, patient communication from a practice perspective? Well, think about how you communicate now. It's primarily through the phone, and phone calls are very inefficient for staff, and of course it can be a huge source of frustration to your patients. So as you think about how you engage in a typical day using the phone, you're making a lot of calls, outbound calls. Patients call in, they get placed on hold, or they go into a vortex of an endless menu system. You're returning calls or returning voicemails, and you're playing phone tag essentially, and then you have incomplete messages. And so there's a lot of documentation that you have to engage in around all this phone tag activity. So it can be very, very frustrating, not just for you and your providers and your physicians, but also for your patients as well. So here's sort of a worst case, best case scenario on a typical phone transaction that pulls people in. Worst case, you could be spending up to 11 minutes of staff time dealing with a patient phone call, and then you're pulling in a physician or two, and then you're also doing a lot of other things that are wasteful. You're waiting, you're writing notes, you're documenting, etc. A best case scenario is 5 to 7 minutes. You're only, and I use that term loosely, taking up 1 to 2 minutes of a physician's time. So these are still problematic, whether it's a worst case or a best case scenario. So the message here is that, one, patient portals can really reduce some of that waste or the inefficient use around using the phone to communicate with patients. So another thing that patient portals do around the communication process is it gives you the ability to route patient questions to the appropriate person through the workflow function of the EHR, and also gives physicians the ability to communicate with their patients directly, which again, that's really what consumers and patients want. And then two, it also creates a better sense of connectedness among the patients. And so there's this concept of asynchronous communication, and that simply means that providers or staff can communicate with the patients when it's convenient for the for them to do so. So they're not pulled into the immediacy of a phone call to answer a patient question. So that a best practice, too, would be you're responding to patient emails at the end of the day or the beginning of the day. And I know some of you probably already do your phone calls that way, but it's much more efficient if you're communicating electronically and you're blocking out that time to do so. The other interesting thing is that when providers or practices move to a patient portal and they're really developing robust communication processes, they're reporting a greater sense of satisfaction or less frustration, which of course means less stress as well. So patient portal is really a two-way communication practice conducted over the internet, and it really gives patients the ability to engage in self-service. So it's reducing some of the transaction costs that you have around not just communication but also data entry costs. It allows patients to enter information, and you can collect that information. Of course, I mentioned the asynchronous communication, which again is a communication episode that's convenient for you, and you're not getting pulled into the immediacy of the phone call. It's HIPAA secure, and it really overall can reduce some of the phone calls that you're getting. And as I work with some of the providers out there, some of the practices out there, that's one of the main chief complaint, if you will, is just a ton of phone calls coming in. So I promised you some best practices, so here's one outcome. So this particular practice had over 9,000 active patients, and they were just simply getting overwhelmed with too many phone calls, and it had a big part to do with staff and provider frustration, and then of course patients were frustrated too. So they really got nearly 6,000 patients enrolled into their portal over a 2-year period, and the outcome was that they're able to decrease phone calls by about 60 calls per day, and so that's pretty impressive. And so if we think about that, that equals about 95 minutes of extra time for the medical assistants each day, and that's time that can be shifted to other more productive tasks. So not that communication with your patients is not productive, but there's certainly a better way to go about doing it. The other thing, too, I mentioned cycle time in my opening comment. So again, cycle time is simply the time that elapses from when a patient signs in until they exit the practice. So again, think about cycle time as when a patient comes in, how they move through the practice, and how they exit the practice. And one of the things that I see consistently working with practices is that one of their big areas of concern, aside from phone call volume, is that the sign-in time takes longer than it should for new patients. And so it can take it's actually up to 30 minutes or more for new patients. So you can really reduce that sign-in time for new patients if you use the patient portal. And so think about your typical unprepared patient as defined by a patient that arrives with no paperwork, oh, I never got the paperwork, or it's not complete, they don't have their labs done, etc. So what patient portals allow you to do is they give you the ability to pre-register that patient before they even get there. In fact, some practices are actually using kiosks where they can register patients en masse, so to speak. So anyway, the key point here is that patients can enter all their key information, their demographics, their insurance information before they even get to your practice. And the practices that have fully deployed patient portals and use this pre-registration feature or process, if you will, have fewer unprepared patients. And so it's no surprise that they've reduced their cycle time. So just something to consider, if you're taking 10 to 15 minutes, more than 10 to 15 minutes for a new patient sign-in, then this is something that you want to consider, because that's what the ideal sign-in time is. Yes, that is for a new patient. So patient portals can reduce that sign-in time by up to 50%. So something to think about, and this is kind of my visual on a typical patient visit at a very high level. It starts with sign-in, and it ends when the patient actually leaves the practice. And so, of course, the little symbols there indicate different timestamps throughout the patient encounter. But my point here is that patient portals can really shrink that patient sign-in time. I also want to talk about some of the common myths as promised. So, and these are not in sequential order, but one of the common myths we hear is that the physicians will spend too much time responding to patient emails. and that's simply not true. What happens is the providers are actually going to gain more time because of the efficient way that patient portals allow them to communicate with their patients. And so you've got decreased phone volumes, and the emails can be triaged, so they're going to an appropriate person on the care team. They're not necessarily going right to the physician. So a lot of those emails can be answered before they don't even have to get to the physician in some cases. Another myth is that older and lower income patients won't or can't use this technology. And you recall my earlier comments about how often people, consumers, use the internet for different things, whether it's shopping, making travel arrangements, etc. And so this is, I think people are more wired or more connected from a technology standpoint than we realize. And so again, most patients, when you survey them, are definitely in favor of using an online method to communicate with their providers. And the other thing, too, is that even in rural health settings, these clinics have had a lot of success with getting patients to enroll, not just enroll, but to actively use the patient portal. And so there's a lot of research out there that kind of debunks that myth that older patients or lower income patients won't or can't use a patient portal. Another common myth is that patient portals will be a form of telemedicine. It replaces that personal contact with the provider, with the physician. And again, I think patient portals are good from a patient perspective and good from a physician perspective. But when you think about how patient portals can be leveraged to build that sense of connectedness, I think this kind of flies in the face of that myth. This is not replacing care. It's simply enhancing it and giving us a more efficient way to deliver that care. And then I'm not going to really go into this. This is something you can use for future reference, but this kind of expands on some of the other myths that we see. I will mention the second myth: patients will use messaging inappropriately. And so I'm going to talk about kind of some of the vital behaviors that we want to instill around getting patients to use patient portals appropriately. But this is simply not true. I mean, patients will use the patient portal in the manner that you train them or teach them to do. So, but anyway, you can have this for future reference. Another best practice I want to share with you is around enrollment. And so this particular provider had only 63 patients in the first month, which is what we tend to see, very low enrollment when you first deploy the portal. However, at the end of the first year, they had over half of their patients enrolled in the patient portal. And what they did was they actually made the enrollment process part of the rooming process. And so by that, I mean they created scripts, they had talking points to communicate with the patient at key touch points throughout the visit, and they didn't do it just once. They reinforced that messaging at different stages of the patient visit. So some more benefits of patient portals or actually uses. So really, patient portals can give you an effective way to clarify or take action on routine issues, whether it's med clarification questions, whether it's accessing lab results, prescription refills, very, very popular. These things take up a lot of your time, and even billing questions can be answered without getting into that wasted space of phone tag. So really it helps simplify some of your administrative tasks, but I think more than anything it provides convenience and access to your patients. So very important point there. Other additional benefits is it gives the patient, gives you the ability to verify your patient's insurance prior to their appointment. It also has a financial piece as well. So if you use the patient portal, so the patient can actually pay their co-pays, make credit card payments, it can have a positive impact on your AR. So the other thing that's interesting, and the research is quite clear on this, and it should be no surprise, is that when patients enter their own data and information, perhaps in a pre-registration process or a registration process before they arrive for the visit, they make less errors. And if you think about that for a second, your staff are engaging in 50, 60, or more transactions per day where they're entering this data. For that patient, it's their only transaction that day, so they're much more thoughtful and deliberate as they go about entering that information. The other thing, too, is when patients enter their own information without errors or few errors, your flow is going to improve because, again, as I mentioned previously, you're going to have less unprepared patients. And I think when you have more engaged patients that are using the portal, you're going to have less no-shows. And no-shows can just kill you, right, because you have no way to respond to them. It's not like a cancellation. So the other thing, too, I think you're going to have fewer transactions as well, which means you're going to have fewer costs for your staff. So what we're really trying to do is push, I shouldn't say offload, that sounds so bad. We're trying to transfer some of this data entry work to the patient. And again, it can help you, but I think the patients really appreciate it as well. So here's something to think about. My question to you is, how much time do you spend on these tasks, whether it's scheduling, processing prescription refills, playing phone tag, providing test results, and just answering general questions? And so if you think about the typical 8-hour shift, you have about 480 minutes available to work in that shift per person. But you really only have about 360 minutes because of natural work stoppages, people have to take breaks, etc. So the question is, how do we maximize that available 360 minutes? And by deploying a patient portal, you really can drive productivity and efficiency throughout their practice. And so this is really about enabling and empowering patients as well, so it's not just about efficiency and productivity from a practice perspective. We're allowing patients, for example, to look at their records, to view educational materials, to review their visit summaries, even to, and this is very popular, even to get return to work or return to school forms. So, and then patient reminders too. So these are some features that you can really leverage on a patient portal. Less time spent relaying messages back and forth, which I kind of touched upon, and then working overtime responding to voicemails. And that's just not from providers or physicians, that's also from staff. So providers or practices that have really deployed patient portals and leveraged them well have seen a decrease in some of their overtime or some of their labor costs. And then, of course, if you're mailing out test results and all that, all the activity that entails, such as folding envelopes, stuffing the envelopes, and postage, these can be not only time-consuming, but also very costly as well. Just a key point here I want to make, even though this is technology, as I mentioned earlier in my visual around practice transformation, this is about people, process, and technology, but this is not simply a solution where you can plug and play and flip a switch and say, okay, we've got our portal, we're good to go. There's a lot of stuff that you need to do around that patient portal. You need to define and plan out your processes and your workflow. What are your procedures and policies, for example, around response time expectations, how messages get routed, and how do you go about the enrollment piece as well. So, and to me, this is really the standard work. Who's going to do what, when, and how around the patient portal from your operations perspective. So it's not again, it's not as simple as flipping a switch and hoping you're good to go. So a few closing thoughts here. You know, when you think about patient portals and where we're going with patient portals, we only see the portals getting more widely used, and they're going to be embraced and accepted, not just by practices and providers, but also by consumers. We think consumers are going to demand this access more and more, and it's especially driven, of course, by meaningful use, which Dan talked about earlier. We know that patient portals can help drive patient satisfaction, but also, very important too, provider and staff satisfaction. We know that portals are going to help streamline processes and kind of lower some of your operating costs, and that's primarily through driving productivity and efficiency. And again, very important, patients want the convenience that these portals provide. So this is kind of my visual to think how to think about patient portals and using the internet. I thought it was a nice picture. So really, that kind of concludes my comments. So I just want to wrap up by saying that just remind you that MCEDA offers a variety of services, some of which are covered by state and federal subsidies. So today we touched on some of the basics of patient portals to help you achieve meaningful use. and how you can use your portal as a tool to drive practice transformation from a productivity and efficiency perspective. So if you're interested in any of our meaningful use assistance to engage us, or if you'd like to engage us further, you can contact us at 1-888-MICH-EHR, which I think that's, there we go. Or just go to our web page, go to our website, which is on your screen there. So I hope this was informative, and I'm going to turn it back over to Judy.
Okay. Thanks, Chris and Dan. Great job. We do have a few questions rolling in. The first one, will the slides from today's presentation be available? Just so everyone knows the slides, the summary of any questions along with the answers provided, and a link to the recording of the webinar will be emailed to all attendees. Additionally, we will post that information at mcida.org. Next question for Chris or Dan. We have multiple sites. Can we roll out our portal in steps and by site?
Sure, that's a great question. I think in a lot of cases, and some of the ways that MCEDA works with our clients is to look at exactly that. So if you're going to adopt a patient portal, you want to make sure that you're doing it in a measured fashion. So you are introducing the portal through, you can think of them as phases, or I hesitate to use the word stages, I guess, too much of that. But when you first get the portal, you want to make sure that staff and providers are all familiar with it, and they're offering any kind of thoughts that they have on the workflow process. When it comes to introducing that or implementing among your patient base, you want to pick one site. That is one way to approach the whole rollout of the patient portal. So look at a site that you want to, again, kind of test the portal and the use of the portal at that site. And again, work on any kind of workflow issues that might arise from that initial implementation to your patients. So it also helps if you have a cohort or some type of patient feedback loop at that initial rollout. And then that would be followed through a phased approach for perhaps additional functionality on the portal, and also roll out at all the other sites. And any lessons learned from that first implementation you'd carry over to the next site location that you want to implement the portal, and kind of proceed in that direction.
Okay,
hopefully that helps.
Okay, next question. What if we don't like our EHR portal option? Can we use a different vendor or another service?
Let me take that one too. So what's implied in this question is that most software vendors that you're using that are certified, they have to have some type of patient portal functionality, whether it's one that's homegrown and fully integrated or one that they kind of bolt on to their own system. So there's all different kinds of varieties out there. If you don't happen to like your EHR portal options, you can look elsewhere. There's other standalone portals that can be used. This comes with other considerations, though, that you have to use in your ultimate decision for which patient portal you're going to go forward with. So, for instance, the portal that comes with your existing software usually is integrated with your EHR, but if you were to go to a something off the shelf and bring that in, you have to create an interface. So there might be additional costs there involved, and as well as migration of information from your EHR to the portal. So those are things you will need to consider as you look for other options. One other thought is that anytime you add a module that's not already fully integrated, you're usually dealing with another source for service. So if something is not working at the portal level, you need to go to dial a number to create a ticket on that side, and EHR similarly on that side, and sometimes they tend to point fingers at each other if it has to do with the migration of information. But there's definitely some options, some better than others, and cost is certainly going to be one of the factors that comes into play.
Okay, I'm going to combine a couple of questions that have come in. Next one I think will probably be for you, Chris. On average, how long does it take to get patients engaged in using the portal? And do you have any suggestions for strategies on how to engage some of those more difficult groups, like senior patients or the low-income?
Sure. So two good questions. So if you recall the best practice slide I shared around enrollment, so the practice in the first month enrolled 63 patients, I believe. It took them fully 2 years before they got over half of their patients enrolled. Typically, we see about within the first 6 months you're getting some traction, and I don't have a specific percentage for you, but you could expect to spend about 6 to 12 months before you're really getting significant numbers, maybe 25 to 30% of your population enrolled. Now, that enrollment, so you can deploy the portal. This concept or notion of enrollment is a whole different project in of itself, so you've got to be very thoughtful. It's really about heightening awareness around the benefits of a patient portal, how it can help, ensuring that people are, I guess, assured that their information is safe and secure. And I think one of the things people want more than anything is the ability to schedule appointments and message their provider. So what we found that if you're very, it's almost like a campaign, right? It's like a marketing campaign. So if you're focusing on those key selling points, I guess, for lack of a better term, that can really help. And so there's a lot of research out there in terms of how people have been successful at enrollment, particularly with seniors. So if you want more detailed information, you can reach out to me directly. And I can get that to you. But again, expect to see results in 6 to 12 months. And if you're dealing with a difficult patient population, elderly population, it's simply about reinforcing the value proposition and how patient portals can help them. And also, some practices have found, even among difficult patient population like elderly patients, they found a few that gave it a try, and they could also serve as sort of like a testimonial to other patients as well. So.
Great. Okay, and one last question. What are the common functions practices select when setting up their portal with their vendors? How do they get started? I believe
yeah. So one of the features we like to see used, if you think about what features you're going to use, aside from the meaningful use piece where you have to provide access to patient information or to their health information. One of the things that we see is scheduling and prescription refill requests. And if you think about it, those areas really bog you down from a productivity perspective. So those are two popular areas. So anything that we can do to reduce some of the time that you spend on certain tasks, like prescription refills or scheduling, would be ideal.
Okay, great. And that appears to be all of our questions that have been received. So we thank everybody for attending, and we look forward to offering a future webinar in the very near future. Thanks, everyone.